As Head of Quality Improvement, part of my role is to coordinate and facilitate our Quality Champions programme. And our aim was to recruit as many staff as possible from all parts of the organisation, at all levels and in all roles, to be quality champions.
Well, there are 3 levels of quality champions. There's bronze, silver and gold. Now, to get onto the first step of that, the bronze, quality champions have to do 3 things. First of all, they simply have to volunteer to be a quality champion, but with the support of their line manager. Secondly, they have to undergo training during which they will learn the tools and techniques, because healthcare improvement is actually a science and you can learn how to do it. And thirdly, they have to embark on some project to improve quality within the organisation. So quality champions are the agents of improving quality in our organisation.
As a quality champion in the organisation, I wanted to look at reducing the number of catheters that we had for our patients who had been admitted to hospital. It became evident, because we collected data from the NHS safety thermometer, that our patients had more catheters in place than the national average. So embarking on the first of the Quality Champions programme, I became in touch with colleagues who had a similar interest. And these colleagues, we formed a multidisciplinary team, and that consists of a consultant urologist, somebody from infection control, somebody from business intelligence, and also ward staff. And we formed a catheter UTI improvement group. And one of our aims is to reduce catheters by 15%, and we set ourselves a target to do that within a 12-month period.
To get a silver award, you have to have had a success which is both measured and sustained. So you need to be able to give the facts and figures about what the situation was before and afterwards, and to show that it's been maintained for a good period of time. For the gold level, you have to do something on a wider stage than just inside the trust, possibly regionally or nationally.
To date, we've got approximately 30 improvement projects being delivered by our quality champions, and these can be clinical or non-clinical. So, for example, some of our quality champions are working on things like reducing harm from events like falls, urinary catheters and pressure ulcers, whereas others are working on things like the administrative processes such as admission letters and improving some of those processes for patients.
When you do the programme, you have to decide a quality improvement project for your own. And of course, people can quite sometimes think about something very big and grand, but sometimes the very simple stuff that makes the biggest impact. We had a patient on the wards at Wrightington earlier on in the year who came in for a very routine hip replacement. We do 2,000 of them a year here, and for him, he was 68 years old, and it was a very routine procedure. However, within 24 hours of him returning back from theatre, he started to display some worrying signs. Very soon after that, became agitated again and used his mobile phone charger cord to wrap around the neck of one of our nurses and attempt to strangle her. That is post-operative delirium. In its probably most severe form, and post-operative delirium can affect between 10 and 40% of patients undergoing orthopaedic surgery. My project is aimed at making sure that we identify those patients early, that we assess patients' risk. If you're over 65 and you have dementia, then you're at far greater risk of this condition. So it's about identifying those patients early, during their stay, monitoring the condition, monitoring for any signs of confusion, delirium, and you can see that from that case he had very subtle signs in the first instance of just becoming withdrawn and quiet, but that's a key symptom. And then the third bit is to, when we do have patients who become confused and agitated, that we take the appropriate steps to prevent the patients from being harmed and also the members of staff.
I think almost all staff working in the health service are enthusiastic about quality, And what we wanted to do was to liberate that enthusiasm and give it the training that is needed to turn enthusiasm into real results. Even in an organisation like WWL, which has been working on quality for many years, there are still lots of things that aren't as good as we would like them to be. And it's much better to have somebody volunteering to say, I want to improve that service, rather than management in a top-down way saying, go and improve it. Because that way you get much more buy-in and much more enthusiasm. So we now have over 150 quality champions, and I'm hoping that that is a huge amount of quality muscle that can be exerted to improve services inside the organisation.
My involvement in the quality champion process came from the initial email and the fact that I like to ask why. And I knew that the people who were going to volunteer and put themselves forward for this were going to be those same sort of people. They were going to be the same as me, asking that question, why? Why do we do it? Why should we do it? Why can't we do it this way? You know, and the team that I'm involved with, we're looking at patient letters. It's very important to me, the patient letter, because that's our first point of contact. That's where we make our first contact with the patient before they actually come to us. And so if we can get that right, if we make sure that's right, the first impression of this trust straight away for that person is paramount. If we don't get it right, then obviously that first impression is less than that. And that's what we don't need in this day and age. We need to make sure we're at the front and we're getting everything right first time. So even though patient letters are nothing to do with what I do, I'm a hotel services manager, you know, we recognise as a team that that was the most important part of the patient experience. That first contact was the key to getting it right.
Well, I have a monthly meeting which is called the Quality Executive, and at this monthly meeting the Quality Champions teams take it in turns to give me an update on the work they've done so far. And I've got so many examples of fantastic work that's been done by the Quality Champions, but to give you 2 or 3 examples, the work that's been done to reduce inappropriate catheterization amongst patients is very spectacular, and again we've got a measurable and sustained improvement there. The work to reduce sepsis in the organisation, one of the most significant causes of avoidable death in the organisation, so reducing sepsis is absolutely crucial. But also, I don't want people to think that you've got to be a clinician to be a quality champion. And one of the initiatives that has given me a great deal of pleasure is led by some of our porters, who have found that the letters that people are sent for outpatient clinics often contain errors. And so they've set themselves to improve the quality of outpatient letters, and I think that's going to be a massive benefit to the hundreds of thousands of people who attend our outpatient clinics every year.
We presented to the Quality Executive Committee and managed to get a member of that Quality Exec on board with us, who brought the right people in to speak to, and the result was that when we did our last audit at the end of August, we had a 95.5% accuracy on patient letters. And the reason we didn't get 100% was because 8 of the letters we'd actually audited were actually from the old system, not from the new. So if we had just had the new, we would have been at 100%.
I feel that we've now built up a really good faculty of quality champions, and that we're really going from strength to strength. Ultimately, of course, we would like every member of staff to be a quality champion and to really promote an improvement ethos throughout the organisation.
I am really pleased and proud of the achievements that we've made as quality champions, not just within the catheter UTI improvement group, but across the organisation. We have made a difference. We can see that we've improved quality. When I talk to my fellow quality champions, I can see a group of staff who are really motivated and they're completely focused on making quality their main priority. The main priority for our patients, our staff and the families that enter our trust.